Think prevention, live long.
I'm Dr. AJ Shah. I'm sitting down with my friend here, Dr. Malinowski. And give me your name.
Luckett.
Mrs. Luckett here. Dr. Malinowski. Dr. Malinowski was my professor in 1988. He comes here periodically to help me out. So, obviously we always welcome Dr. Malinowski whenever he comes. And then we have Mrs. Luckett's nephew, Douglas.
Son-in-law.
Son-in-law, actually. Son-in-law, Douglas McCarty.
McKitty.
Douglas McCarty. When did I see you?
This morning.
No, when we scheduled your procedure day before yesterday?
Saturday.
Saturday. So I saw Mrs. Luckett on Saturday, and we said you will need to have a cardiac catheterization done, which is where we take the pictures of the arteries of the heart. We inject the dye and take the pictures. And typically, since I was in training in Lansing and everywhere in America, most of the time cardiac catheterization is done through the groin artery. But over the time we have learned that it's very risky to go through a groin artery. And if you can avoid it going to the groin artery, that would be nice. So we thought we'll ask Mrs. Luckett to get the catheterization done through the hand artery. And it's kind of interesting because every person, in the right leg there is one artery. In the left leg there is one artery. So our legs have one artery for each leg. And if you do the catheterization through the leg, from the artery which goes to that leg, and if artery has any issue because it's very deep artery, if bleeding happens, the leg will suffer. But fortunately, God gives us two arteries for each hand. Believe it or not. Hand is so small, right?
Yeah.
But God gives us two arteries for each hand. You know why? Because God knew we're going to do catheterization one day.
Okay.
Except 5% of people when they're born with one artery.
No.
So we have to make sure you're not one of the 95 who's born with two arteries, and if you're one of the 5 who's born with only one artery, then we have to go through other hand if there are two arteries, or we have to go through the leg.
Oh.
So first what we did on Saturday, we looked at Mrs. Luckett's hand to make sure she's born with two arteries in the right hand. So we did that, and she's born with two arteries in the right hand. So that's a good start for you last Saturday.
Right.
What do you think, Dr. Malinowski, about this catheterization through the leg and the hand? What are your thoughts? You've been doing it for
I've been doing it for many years. I stopped doing this about a year ago. When I started training, all of the cardiac catheterization was done from the arm. But it was very difficult because you have to do incision on the arm, then you have to expose artery, put the tube in, and after the tube was taken out, you have to close the artery, which was difficult, and many patients develop closing this artery or closing the artery below. And you're absolutely right. Luckily, patients were even developing closing the artery, they were doing okay because most of them got two arteries. But it was a difficult procedure, you have to learn it, that was difficult for patients, not very pleasant cutting. Groin is absolutely right, especially for a patient who are, how to put it gently, not the tiniest in the world, sometimes it's very difficult to get the artery, and if you have a problem with the artery closes, that's a big problem because on one artery, in worst case, patient can even lose a leg because of this. Yeah. So if one can do it from an arm, from forearm, this procedure is usually much less traumatic. This patient, as you know, they can go home much earlier, and they're doing well. So this is a very good approach.
What do you think? Have you heard about cardiac catheterization? Any of your friends or family?
Yeah. I had a friend of mine that recently had it done to the groin.
To the groin.
Yeah.
What was his
And,
experience?
He had a lot of pain.
Pain in the groin?
Bleeding outside of
Bleeding
the
outside?
hardening of the blood.
Okay.
Yeah.
Did he have to stay in the bed for a long time and sandbag and everything?
No, I didn't get to that extent.
No, but okay, so he did bleed some and a lot of pain in there. Okay, so with that kind of thinking and understanding, we thought if Mrs. Luckett needs the cardiac catheterization, and if she has two arteries in the right hand, why we cannot go through the right hand, right? So you came to hospital when?
This morning.
This morning. And what did you have it done this morning?
Well, before I say that, can I say this?
Say please.
I'm one of the patients that had to have the that catheterization in my leg before, and I ended up with a lot of pain and a lot of problems, and I had to stay 2 days in the hospital because they couldn't get the blood under control.
So in your case, before the last catheterization you had some issue in the groin.
Right. and it didn't work out good at all. I still get pains, still shoot pains.
In the groin? And it's been how many years? About 5 years?
4 or 5 years.
4 or
yeah.
5 years.
Mm-hmm.
So you preferred going through the hand.
And
So what happened this morning?
7 o'clock this morning, and it's 5:34 now.
Okay.
My doctor, Dr. A.J. Shah, went and did the catheterization in my arm.
Today?
My Band-Aid today.
Today?
See my cute Band-Aid?
Okay.
I want a Snoopy Band-Aid
Next
next
time.
Anyway, the procedure was really quick and easy. Just a little pain that shot down the arm while they did it. They just gave me a little more medicine where the pain went right away. No problem at all. Went to my bed. And within a couple hours, I was eating, sitting up, and looking at TV.
I think the point is that what she said, that in 2 hours she was able to go to her bed.
No swelling,
No
no
swelling.
discoloration, or
And
nothing.
she was able to eat,
Yeah.
and you watched some TV, and then you left. Please, all of you viewers, listen to this American, okay? Here we have a person who had a major heart procedure done today, heart catheterization, major heart procedure. As soon as I'm done, and I told her she has a 60% blockage, which we can manage with medications, no need for stent. First thing she said, Dr. Shah, can I go back to work tomorrow? Many patients I see, they say, can I have 2 weeks off? One guy said, can I take a year off? One actually person said, can you fill out my disability papers for life? I said, you just had a catheterization. And here we have Mrs. Luckett. She's saying, can I go back to work tomorrow? So I said, well, tomorrow is too early, but we can try. I said, but you have to come and see me tonight. Then I can check your hand if it looks good. She works every day, 7 o'clock to 1:30. You know what kind of job she does? Tell us what kind of job you do.
I sew
She
for
sews.
the military.
She sews for a military. What kind of sewing you do? Flax?
We sew jackets.
Jackets? So you sew jackets for a military. That to me, beside the job, that's the most noble job you can have. Can you show us a hand so we can take it off? And she's going to take it off herself. Okay. Can you zoom into that? Now show me the other side and compare the two. See if you can see it. Other than the little band-aid, there is no difference.
And even better, move your fingers.
She can move her
She got
fingers.
perfectly moving hand. And she's going to be sewing tomorrow with this hand. So it's,
Yeah.
So, do you think we can let you go to sew tomorrow? You decide, Mrs. Luckett. What do you think we should do?
Yeah, I'm ready to go to work.
Okay. Then you can
I'm
go back to
ready.
work.
Yeah,
So I'm glad you came tonight. We checked it out. So our job doesn't end here. Our job starts here. Doing this thing is the easiest thing. Losing weight, exercising, taking your medicine, getting those plaque not progress is harder. You know why? Because doctors can do this thing,
Mhm.
but other things you have to do it.
Right.
And thank God that in 5 years your blockage have only gotten minimally worse. I was worrying that you may have a 90% blockage.
Mhm.
But fortunately, knock on the wood, you have only 60% blockage in on the main artery. But that gets up to 70 or 80, then we're talking about serious stents and bypass. And so starting today, you pretty much have to say this is a good outcome, and
Okay.
let's build on it.
Okay.
You agree?
I agree.
All right. So I think that's a pretty good outcome. I like it. We'll work with the medications, weight loss, aspirin, and you go back to work tomorrow morning at 7 o'clock.
Okay.
Great. Thanks. Thank you. Thanks, Dr. Muraski. Thank you.
Pleasure. Thank you.
If this was a growing catheterization, she wouldn't be walking out today.
See ya.
When we think prevention, live long. The heart of mid-Michigan strong.